Hello, I'm Alex Whitfield. I'm the Chief Executive of Hampshire Hospitals. I'm delighted to be introducing our priorities for the year 2019 to 2020. We've positioned these under our 4 quadrants, which all help us to deliver outstanding care for every patient. The first quadrant's about that outstanding care, the second's about empowering our people, the third's about living within our money, and the fourth is about innovating for our future.
This year we want to continue our journey to provide outstanding care for patients, and there are a number of areas we feel are a priority. First of all, how we care for patients with mental illness in our care. Secondly, how we make sure that families, carers and patients are involved in the design and evaluation of our services. And then 2 specific safety issues. One is about how we care better for the deteriorating patient, and particularly the rollout of the news. And secondly, falls, for how we improve care to make sure patients don't fall in our care and come to harm.
Okay, so what's really important in the coming year is that we deliver really timely services for our patients. Be those patients that are coming to us as emergencies needing urgent care, be those patients that need access to planned procedures or operations, or be those patients that are coming to us with suspected cancer that need treatment. So the way we're going to deliver really timely care is to make sure that we try and improve our efficiency and productivity. So by delivering new ways of seeing patients in outpatients, by ensuring that we maximise the use of our theatre time, and by ensuring that we've got good flow through the hospital are all ways in which we could deliver more timely care in the coming year.
As a midwife, I'm really excited about expanding the choices that we have for where women can birth their babies, whether it be in the community, at home, or in one of our birthing units. I'm also really passionate about ensuring the building fabric that we work with is fit for our staff to provide the care that they want for women and their families.
In the staff survey this year, you told us that we needed to put a bigger focus on staff wellbeing, and we're doing just that. We're rolling out a new appraisal form. It has an entire section for you to talk about with your manager on your wellbeing at work and at home. We're also rolling out training for managers and how to better support their staff through the appraisal process, through supporting you in training, and through new career development pathways.
As a Culture Change Ambassador, I'm excited about taking what we have learned from the focus groups where we have interviewed staff, taking that to the board and seeing how that develops into phase 2. I think it's really important that we think about how we talk to each other and treat each other, and I'm really pleased to see the board acknowledge that.
Another important issue that you highlighted in your responses to the staff survey is the challenge with staffing issues across the Trust. We take this incredibly seriously. We are working on new innovations every day in our recruitment team and are having great success in getting higher levels of staff entering the Trust every month at induction. At the same time, it's even more important to retain the great staff that we already have here. So we've got new and exciting ideas about how to engage you, motivate you, support you in your jobs, and make this a great place to work.
Generating enough income to meet our expenditures is always challenging, and it's not going to get any easier in the coming year. That's why we need your ideas about where the efficiencies lie in this organisation. You know the business far better than I do, and you can bring those ideas to the fore, and you can make those performance improvements and financial savings that are so important to us. Last year we were really successful in generating more money for capital expenditure. That's already had a fantastically beneficial impact on our emergency departments in Winchester and Basingstoke. We're going to be going all out to get more capital funds in the coming year and to be able to progress all the capital plans that we need to keep this hospital at the forefront of delivering outstanding care for our patients.
I'm delighted to be in our new paediatric assessment area in Basingstoke Hospital. This area of the emergency department is dedicated for care of children, and we have a similar unit opening in Winchester. Next year we'll embed this into the way that the emergency services work. The next stage will be to deliver a combined ambulatory care unit for all emergency care patients presenting to Winchester Hospital.
So in the coming year, we're going to be working with our partners, the GPs, the ambulance service and the community health partners in Southern Health, to develop new, innovative ways of delivering urgent and emergency care. So transforming emergency care in Winchester is a key priority for us, and we're really excited about the changes that we hope to make.
The Digital Care Programme is coordinating a fundamental shift in the way we record and manage information in the hospital. There are elements of the programme that are going to save money, reducing paper, postage and dependency on fax, but other elements of the programme are about improving the quality of the information we record and therefore the efficiency and productivity of our services in the longer term.
So I hope you've heard a bit about our priorities for the year ahead. Big thank you to everybody who's been involved. These are really important. These are promises to our people, to our staff, to our patients and to the communities we serve about the things we're really focusing on in this year and beyond.